Hello, my name is Griffin, and I will be presenting my submission to the 2022 DMD conference on the design of a murine model for glioblastoma and validation of that model using ultrasound elastography. Glioblastoma is a devastating disease that is the most common form of primary malignant brain tumor. Its location within the brain, its odd geometry, and its ability to resist standard of care treatments make it hard to remove without any off-target side effects. This leads to a high recurrence rate and an abysmally high long-term survival rate. Treatment costs are a heavy burden for the more than 10,000 patients a year that are diagnosed with glioblastoma in the United States alone. This disease has claimed the lives of notable figures such as United States politicians Ted Kennedy, Beau Biden, and recently John McCain, as well as famous drummer Neil Peart and famous actor Tim Conway. For glioblastoma, one rising treatment that has the potential to save lives is called focused ultrasound. This is a form of therapeutic ultrasound where ultrasound beams are aimed to converge at a small focal region on the millimeter scale, which can have a therapeutic effect based on the intensity of the wave. High-intensity focused ultrasound can non-invasively ablate tumors using hyperthermia, or liquefy tumors in a mechanical process known as histotripsy. Lower-intensity focused ultrasound can create transient openings in the blood-brain barrier to allow therapeutic drugs in, and activate chemical sensitizers. The popularity with this up-and-coming treatment is based on its non-invasiveness and cost-effectiveness as compared to other glioblastoma standard of care treatments. In the development of non-invasive ultrasound therapies, the use of animal models is important as they provide a complex biological environment to show the efficacy of a treatment strategy as well as any potential side effects from therapy. Due to their cost and availability, rodents are the ideal animal model for emulating glioblastoma in humans. Accordingly, the use of patient-derived xenografts in a non-invasive intracranial environment is important to test therapeutic ultrasound technologies, as they would provide a robust experimental result necessary to obtain FDA approval for clinical trials. Furthermore, the establishment of an animal model and then characterization of the tissue from that animal model can help plan experiments, create simulations, and standardize treatments to provide a general validation of these ultrasound technologies. The question is, how do we use these models to plan research? One method that we can use to characterize animal model tissue is known as elastography. This is a technique that takes advantage of the different mechanical and acoustic properties of glioblastoma tumors when compared to normal brain tissue. Here, an ultrasound pulse wave is sent through the tissue, inducing a perpendicular shear wave, of which the velocity of the wave as it travels throughout the tissue can be measured. Because of the difference in tissue properties, the shear wave should propagate at differing speeds than in normal tissue, and these differences we can use to model tumor and derive other important ultrasound parameters such as the elastic moduli, acoustic impedance, and total acoustic energy that is reflected at the tumor boundary. In this study, we have implanted human patient-derived xenograft glioblastoma cells into athymic rats to test the ability of the cell line to grow a tumor in an animal model. The growth of the tumors and their effects on the animal were observed. Additionally, this was repeated in mice, and their intact brains were extracted, and elastography was performed to measure the acoustic properties of the tumor and brain tissue in an ex vivo environment. The tumor cell line was originally collected from an 83-year-old woman with a primary glioblastoma tumor in her right temporal lobe. After implantation in all 3 rats, MRI images showed that these tumors grew to consistently significant sizes within 20 days. All 3 animals had an initial gain in weight and then drop in weight as the tumors became more significant. This shows that we can grow this glioblastoma tumor line consistently and that the results we gather from elastography can be used for future animal ultrasound validation experiments. Intact brain tissue with the tumor was extracted and fixed. Shear wave propagation was captured and measured using an Aplio I-800 ultrasound system by selecting a region of interest shown in the green box. The resulting shear wave and its velocities as the wave moves throughout the brain and tumor tissue can also be seen in images B and C respectively. Outlined in pink is the tumor tissue, while outlined in red is the entire brain including the tumor tissue. There are clear differences in the velocities of the shear wave between the 2 tissues, confirming our hypothesis. A circular region was chosen from known sections of both tissues, and the acoustic shear wave velocities were averaged. Various other acoustic properties of the tissue were then derived. As we are testing post-mortem tissue that has been fixed, the values we have determined here are not necessarily representative of what they would be in an in vivo environment, but rather shows a proof of concept that the potential for the usage of elastography for the aid in development of animal models and treatment planning. The stagnancy of glioblastoma prognosis outcomes in the last few decades is exceptionally concerning given its high term mortality rate. We are very excited as an acoustic engineering community for the progress that focused ultrasound has made for treating glioblastoma. But given the potential lives lost, we would like to increase the speed at which research is happening for this treatment. We can do so by using animal models with human patient-derived xenografts for validation of treatment as well as planning and simulation based on elastography data collected. Thank you for watching. I am happy to take any questions at this time.